The New Mexico School of Medicine, which is a division of urology, strives to provide the highest standard of medical care to all people in New Mexico. They train and educate clinical scholars who share an interest in urology and related disciplines. Joining us this morning is the Assistant Professor of Urology, Francis Alba at UNM. Francis, thank you for joining us this morning. So, a lot of people don't know, what exactly is urology? What does that cover?
Urologists treat a broad spectrum of illnesses and disorders that involve the genitourinary tract, including kidneys, ureters, bladder, male genitalia, pelvic floor, prostate.
Okay, so it covers a broad spectrum of that. Now, the first question, just listening to that, would be, is urology just for men, or it's men and women, or it's a broad spectrum?
Not at all. We treat men, women, old, young. Probably our practice is a good 50-50, men and women. A
good 50-50. What are some of the common things? Now, you said you treat a lot of this. What is most commonly covered in urologists? What do urologists mostly see?
We see a lot of kidney stone disease. We treat men for enlarged prostate, sexual dysfunction. We treat patients for bladder dysfunction, for example, related to neurologic problems like spinal cord injury or stroke, for example. Wow. We treat cancers of the kidney, the ureter, bladder, prostate, testes, and most excitingly, we use and employ a lot of minimally invasive laparoscopic and robotic approaches to accomplish treating many urologic problems and urologic cancers.
So let's talk about that, because I know, most men, when we think about, when we're talking about areas like that, we get a little concerned about invasive surgery. So how do these procedures work? Is it just a small incision that's made, that you have sort of an endoscopic camera that goes in and does the work?
Laparoscopic and robotic surgery utilize, the surgeon is able to utilize these tools to accomplish removal of an organ or repair of an organ using cameras and very small incisions. And in general, it results in less postoperative pain and faster recovery, faster return to normal activities.
Yeah, that's very important. So if someone is concerned they're having some issues, their doctor, their primary says, you know what, I think you need to see a urologist, what is the best way for a potential patient to get in contact with you guys?
We have information about patient access on the UNM website and the Sandoval Regional Medical Center website. I work at Sandoval Regional Medical Center as well. I have a general adult urology practice. There's information about obtaining appointments on the website. Because we're a smaller community hospital, we generally have shorter wait times, easier access.
That's great.
But we still maintain the access to the expertise that you expect at UNM, as well as the latest advances in technology.
Yeah, that's fantastic. Well, folks, for more information on the Sandoval Regional Medical Center, and if you would like to contact one of their urologists, if you got a question about something, head over to casa.com and click on the Style tab.